So today we're going to do a middle finger trigger release using the trigger tome instrument. And to get started, before we do the procedure, I like to mark my landmarks, and the patient's hand is obviously not sterile now. We like to measure the distance between the PIP flexion crease of the finger and the proximal flexion crease of the finger. And that distance, which in her today is going to be about 2.4 centimeters. We're going to measure that exact distance back to the level of the palm here. We're also going to mark the valley of our carpal tunnel, and that marks the trajectory of our flexor tendon sheath and our instrument. And so we mark those landmarks. The distance between the PIP and proximal flexion crease measured backward marks the proximal edge of your A1 pulley. In general, most A1 pulleys are about 1 to 1.4 centimeters in length. So I draw a box where I expect that to be, and I draw it at least a centimeter, and our flexor tendon should follow that trajectory back towards the palm. Once we get our area marked, in her you can feel she has a small retinacular cyst as well that we're going to lyse when we do the actual procedure. So we're not only going to release the A1 pulley, but we're also going to lyse the retinacular cyst. I'm going to ask you to flex and extend your fingers to show them the extent of the triggering that you're getting. Open up. Close. Open up. Okay. So our incision is going to be roughly 2 to 3 millimeters long, and it'll be just proximal to the proximal flexion crease. And we're going to dissect back to the edge of our A1 pulley and slide our instrument below, and we'll show under ultrasound where the instrument is within the tendon sheath below the A1 pulley. Prior to that, we will dissect subcutaneously above the A1 pulley to accommodate the hemicannula portion of the instrument, which is the blade protector, and I'll show you all that in a couple of minutes.